Just like there's this kind of epistemic black hole of just like, we don't know what we don't know. And with this particular crisis, I just think like there's so much information that's way beyond the frame that we don't know. And I think until we actually know what the fuck is going on, like we can't even talk about calibrating a policy response. Like we don't even know what's killing people anymore. But I think what COVID has taught us is like our country and our culture can metabolize a fuckload of deaths and just kind of like go about living, right? So it's kind of grim. Like, I don't want this episode to be so depressing, but we might have to go there.
Something else is completely overlooked is that this is a polydrug crisis. I mean, to list fentanyl as the cause of death is like almost a misnomer.
Maybe that gets to the core of it. It's not the drugs that are the issue. It's the mass surveillance and the police state that we live in that needs to justify its existence.
You're listening to Narcotica, a podcast giving you the straight dope about drugs and the people who use them.
There's a fun thing that happens when you work long enough in drug policy. You just want to start screaming. Ah! Despite harm reduction becoming a more mainstream philosophy, piecemeal reform efforts are doing little to stem the rising tide of overdose deaths in North America. I mean, it's a little like trying to stop a flooding dam by sticking your finger in the crack. With grim statistics only getting grimmer, I can only imagine how much worse the drug war would be without basic policies like naloxone distribution and syringe access. Evidence-based programs that are like almost boring to talk about because they're just so common sense. But we need to go so much further. It's just that drug policy reform activists are spending nearly all of their time fighting for just the basics. What was everybody screaming about recently? That's right, crack pipes. Thanks to a few bad faith news stories run by conservative media, everyone had to reiterate that supplying a cheap device to reduce harm is in the best interest of public health. It's an endless cycle. Next week, folks will probably have to put out fires again that no, touching fentanyl will not cause an overdose. Will it ever end? I'm Troy Farah, and you're listening to Narcotica. On this episode, it's just a simple conversation between Narcotica co-hosts Zachary Siegel, Chris Moraff, and myself. We're asking the simple question, is the drug war getting worse? Or is it getting better? Like many things, it's not black and white, but before we get into that, here's a little bit about Narcotica. You can find us on iTunes, Spotify, YouTube, and all the rest. Go to narcocast.com to learn more about us. We'd love to hear from you. And here is our one and only advertisement. Narcotica is an independent, listener-supported program, and you can help us keep the show on the air by joining our Patreon. Just parked at patreon.com/narcotica. And yes, we are so grateful to the people who keep this program going. We literally could not do it without you. And that's all the boring stuff. Much better than us trying to sell you a subscription to a box full of meat. That's a real thing people get, meat boxes. And it's advertised on podcasts for some reason. Anyway, we just want to bring accurate, informed drug reporting to you, make it accessible so anybody can listen, and help bring an end to the war on people that's dressed up as a war on drugs. So with me today is Narcotica co-host Zachary Siegel, beaming from Chicago. Say hi, Zach.
Good to be back on the pod.
And also Narcotica co-host Chris Moraff, reporting from Kensington.
Hey guys, hello.
Today we're going to do a little bit of a sit rep, a situation report. Since this is a war on drugs, which is really a war on people, let's take a look at what's happening right now. Is the drug war getting better? Is it getting worse? It seems like there's improvement in some area. There's also a lot of backsliding. So we'll talk about that today. I've just been thinking lately that, being in drug policy long enough, you eventually just want to start screaming at things. And there's a lot of stuff that's happened so far this year that makes me want to scream a little bit. I am really curious, is the drug war getting better? Is it getting worse? It seems like you look at it from one angle and you look at it another. The main metric, I guess, is overdose deaths, and we just keep breaking records on that. The most recent CDC data, I think from April 2021 to April 2020, more than 100,000 people died from drug overdoses, which is just insane.
The latest is estimates and provisional data from September 2020 to September 2021, just a few months past April. And yeah, in that 12-month window, it's 104,000 people, which just like trying to think back to 2017 when this whole catastrophe was officially declared a public health emergency by the government. I think we were at like 72,000 roughly total. Like that was for opioids and stimulants and benzos, like for everything, excluding alcohol, of course, which, we can get into that too. But just like even back then, 70 something thousand was just like obscene and such a global outlier, just like totally dwarfing every other developed country. And yet, like, it kind of got brushed under the rug, and I always just kind of thought, like, okay, if we hit 100,000, like, you can't brush that under the rug. Like, you can't ignore that. But I think what COVID has taught us is, like, our country and our culture can metabolize a fuckload of deaths and just kind of, like, go about living, right? So it's kind of grim. Like, I don't want this episode to be so depressing, but we might have to go there.
I looked a little bit historically at this in reporting my most recent piece, and in 1975, I think it was, they were calling it a heroin overdose epidemic, and 175 people died in New York. Now, more than 2,000 died according to the most recent figures, and it's just the relativity of that. Just 175 people, and across America it was under 5,000, I think. And it's just stunning to think of how exponentially those numbers have grown. The drug war has not helped for sure, and it's hurt, in my opinion.
I keep looking back to this Stat News piece by Max Blau from 2017, which was around the time that the three of us met. And it said, opioids could kill nearly 500,000 Americans in the next decade. And of course, nobody could have predicted the pandemic, which created all these conditions for isolation and overdose and being alone. But like at this point, 500,000 seems quaint.
Yeah, we'll eclipse that at this rate in just a few years.
Yeah, and like we can throw statistics around all day, but like
yeah. I mean that's the thing. It's like these numbers. I was just gonna say, like, these numbers obscure, like the human toll, and just like I remember back when 100,000 people died of COVID, the New York Times ran like a front page spread about like the quote incalculable loss of 100,000, and like I think America we're probably coming up on 1 million COVID deaths at this point. Don't quote me on the exact number, but yeah, I just get kind of tripped up on this kind of fact of human life, or just the nature of being human, is that these numbers really just kind of numb us. What's that Stalin quote? I think it was Stalin or Lenin, who was like, 1,000 Russian soldiers dead is a statistic, but one Russian soldier dead is a tragedy. And it gets just like that. These huge numbers just kind of like dull our senses in some way. Like we can't. It's like asking how deep the ocean is.
Seth Dalton, who co-produced the documentary with me that's coming out, is in Japan right now. He's in Tokyo, the largest city in the world. There's 35 million people there. And when he was heading back, they had only 60 cases of Omicron reported, based on whatever policies and programs they put into place. America has just done it backwards since the beginning, it seems, and the Trump administration didn't help on either front, the drug war or COVID. But the synthetics revolution, I guess, has just been a game changer. We created the avenue basically through the 1980s and 1990s drug war for this proliferation of drugs that now we're seeing nitazenes, like non-fentanyl opioids that are even more powerful than fentanyl. It's endless.
Yeah, Chris, what do you know about nitazenes? Because like that's something I've really been wanting to look into more, but like I keep hearing about these things appearing, and how do you test for them? Like, do they even show up on fentanyl test strips? I don't think they do, right?
No, they're not. They're non-fentanyl. I mean, they'd be more in the class of like the W and the U drugs, the W class and U class drugs that we saw in the past.
Like U400 or whatever that one is.
So we test them in the lab. In fact, we just brought in. Somebody sent me a sample from Chicago, Zach, and there was traces of metonitazene in one of the samples. So we're seeing them, I think, more in the Midwest. Haven't really seen many in Philly. I don't know the history of them. I don't have it in front of me. But like most of these drugs, they were at some point developed as an alternative narcotic, and then have been tweaked as scheduling has created barriers to getting the original drug that was needed. So
this actually brings me to a kind of another scary thought is like back around 2013, 2014 is when like the kind of fentanyl analog wave of the crisis really kind of started to kick off. But so many of those deaths were flying under the radar because coroners and medical examiners weren't testing for fentanyl or any of the analogs during autopsy and toxicology. And so I'm wondering now, like, how many nitazene deaths are just totally going unreported and just completely miscalculated. And I look at the CDC data all the time, and they have the codes that kind of they use statistically to kind of aggregate all these data. And I don't think there even is a code for nitazene. And they're gonna I just think I wonder, it's just like there's this kind of epistemic black hole of just like we don't know what we don't know. And with this particular crisis, I just think like there's so much information that's way beyond the frame that we don't know. And I think until we actually know what the fuck is going on, like we can't even talk about calibrating a policy response. Like we don't even know what's killing people anymore.
Yeah, that's such a good point. This is sort of the logical result of these fentanyl analog bans. Like in 2018 or something like that, the DEA went over to China and was like, stop fucking making these chemicals. And they're like, okay, fine, we will. And now these like weirder things are showing up. And just another example of the iron law of prohibition. Sasha Shulgin, the famous psychedelic chemist, predicted the fentanyl, the whole fentanyl thing, he predicted in the late 70s because he just, you look at the economic value of something that's able to be transported in smaller and smaller amounts. The surprising thing is that it took so long for fentanyl to become the dominant opioid in street drugs. And now we're seeing it become completely different substances. Like, I don't even know what nitazenes feel like how to, the differences between that and other opioids.
No idea.
And something else is completely overlooked is that this is a polydrug crisis. I mean, to list fentanyl as the cause of death is like almost a misnomer, because had that person just taken fentanyl and not also had benzodiazepines or methamphetamine or something else in their system, they may be alive. So that was really the impetus for me to start calling it the overdose crisis rather than the opioid crisis, because I felt that was a real misnomer. I mean, 85 to 88%, something around there, of overdoses have more than one drug. And going back to the 70s in New York, the numbers I looked at, that was attributed to alcohol mixed with heroin. Really, there was a rise and there's a reason for everything, and people were buying cheap bottles of Thunderbird wine to use the cap as their cooker, and they would drink the wine, and that's probably the worst mix there is like alcohol or really any depressant. The benzo dope we're seeing in Canada is really concerning. Xylazine dope here, it's like they're really blending. It's a blend more than just fentanyl. In fact, we see bags that have less fentanyl than xylazine, so it's not, but it'll be still tagged as an opioid death, which has a backlash on pain patients, which has a backlash on, creates misinformation. And it's just a, vicious cycle.
Yeah. Speaking of pain patients, have either of you seen Dopesick? Because, I haven't watched it, and I feel like, oh man, I'm like, maybe I need to get on this and see what the fuck these people are talking about. But it's just it's such an oversimplified narrative.
It feels like homework to try to watch a show like that. It's in my free time, the last thing I want to do is that, because that would be something I would pitch and get paid for to do. I've reviewed movies and books and shows. I like doing that stuff, but I think there was something about Dopesick or just these kind of new iteration of films and shows that just I couldn't even look at them. So I did watch a few episodes of Dopesick, and basically what I did see in the beginning was what all three of us have seen endlessly, which is that opioids are sort of painted as mosquitoes carrying malaria, that anybody who touches them comes down with addiction. And so there's just this kind of direct, very simplified one-to-one kind of relationship between doctor writes prescription, person takes OxyContin, weeks later, months later, they're, on the street, totally addicted. So we all know that that's not how this stuff works, right? And that it's not the relationship between opioid prescribing and subsequent addiction and mortality. It's a really messy relationship. It's not a one-to-one causal thing. And I just don't think a show or a movie, can really kind of capture that. I just think it's such a messy, complex thing. And it's just so much easier, especially for liberals, to just kind of vilify the Sacklers and blame big pharma. It's kind of just a perfect narrative for the kind of to generate the righteous anger of liberals to be mad at pharma, which I'm all for. Pharma sucks, but it's not going to help solve our problem.
I need to keep constantly remind myself that I'm immersed in and reporting on the bottom 10% of drug users, probably maybe even less. We don't see the functional drug users, so because they live normal lives and generally keep what they do to themselves. So, we have been fed a narrative based on the lowest common denominator of what can happen to a person, living in the street, shooting up on the sidewalks in Kensington or in the hollers of West Virginia, and the fatalities, but how many chronic pain patients have been taking OxyContin all their lives and take it as prescribed and maybe feel good from it, but that's where the manageability ends, So that's kind of something that I think is overlooked, is we don't. I'd love to do something on functional drug users.
Yeah,
functional users of hard drugs, what we call hard drugs.
Yeah, there's no cultural context to understand what you just said. We have endless depictions of the kind of very hardcore, chaotic, severe end of addiction, and I also think it's not even those people in that group that are necessarily driving the mortality as much. I think a lot of the kind of surge in overdose deaths is coming from just this kind of totally chaotic drug supply that we've never dealt with before. People don't have a tolerance. They think they're taking a Xanax, but it's really something else, or counterfeit pills. There was that crazy story out of Connecticut where some middle schooler or high schooler overdosed on fentanyl, and they found 40 bags on this young kid. It's these are such potent substances. There's no way a 13-year-old has a tolerance for it. So I really wonder the latest age breakdowns, how much of the most recent surge in mortality is coming from naive users, for lack of a better word.
Yeah. What I'm really confused about is why the market hasn't stabilized. Like, people that traffic and sell drugs, like, they don't really want to kill their customers. A lot of them don't even know what they're selling. But, like, why haven't we gotten to a point where it's like, oh, this is stuff that is less likely to kill you? It just seems like put whatever you want in a bag, and if it makes you feel a little loopy, then you can sell it. I don't know.
I mean, speaking only from Philadelphia, like, because I can't extrapolate this to America, fentanyl has like lowered the cost of investment, the cost of entrance into the heroin market, so to speak. So you're talking, really inexperienced. What used to be a multi-generational business model that involved some rules and some structure.
There was a code, man. What happened to the code?
Yeah, exactly. Has devolved into like, who can get to, $2,500 together to get like, some fentanyl and some xylazine and pop up on a corner for 4 days and make as much money as they can and disappear.
That's why what Dolph is doing is so fucking amazing. That's the Drug User Liberation Front in Vancouver, and they're giving out meth, cocaine, and heroin that they've sourced from the deep web or the dark web or whatever. They bought it using Bitcoin or NFTs or something ridiculous. But it's like they test it every which way. They're making sure this is pure, the actual drug content, and they're giving it away for free, usually in front of the police station in downtown Vancouver. And the government's just kind of like, kind of looking the other way for now. I'm really curious where that's going to go. I did speak to somebody from there, and they were talking about, like, hey, we're still dealing with cartels. We're still sourcing our drugs from criminal gangs, basically. But we don't have another option, and we're just doing this until the government basically steps up and gives us safe supply. And they're risking arrest, they're risking so many other things, and people are freaking out, of course, because they don't understand. But what else are you supposed to do? This is literally a war, right? People are dying in the hundreds or thousands per day, and you got to do something. And I feel like Dolph is at least doing something that's effective. I'd even try it, just, I've never had pure meth.
We should do a trip to Vancouver and buy or get the free tested drugs and just see what that's like.
It's all free. They're not making any money, which is
right.
Which is amazing. Like, they're dumping their own cash into purchasing this stuff.
Back to the idea, like, we're still dealing with cartels and criminal gangs, and to your question, Troy, about the market volatility and why it won't stabilize, like, I kind of have this fantasy of what if, groups like Dolph or other kind of harm reduction groups in America, like the urban survivors, how could they get a meeting with the cartel bosses in Mexico? Like, picture all these people at this long table in, like, Mexico, like they're at this beautiful villa by the pool or something in a vineyard, and they're all hashing it out. Like, you guys are the ones killing all of us. Like, we're your customers, and we've been in business together for so many years. Like, why? Like, how could there be some kind of meeting of the minds to get the cartels and the manufacturers to listen to these groups, and they could hash out some kind of regularity in the market? Like, could that happen? Like, that's a TV show that I would watch.
There used to be like a buyer's club of some sort around, a drug buyer's club. And I don't remember what city it was in. Somebody told me about it a while ago where, yeah, it was like a group of users in a city, like organized, I guess, kind of like a drug users union, and was buying in bulk, like from, certain places. It's certainly possible. But
yeah, who would broker that deal? Like, how does that get set up? And yeah, right. Like, oh man, it just, something like that has to happen. Otherwise, like, just, I don't know how else this could end. And what you just said, Chris, reminds me of, like Chicago, where I live. There's just been this long legacy heroin market here going back decades. And at the top of it, there used to be like brokers. There would be people kind of buying in bulk that would then kind of give it to the bosses in various neighborhoods. And from there, it would get cut and get to the corner. And so, yeah, like there is, even in this totally unregulated, illicit market, like there is some type of structures, and there has historically been like hierarchy and organization. And, you know, it just makes me think that to the kind of freelancer effect that you've talked about, where just all these crews kind of can get in at the bottom, and then it becomes a race to the bottom, basically. It's like something like that clearly has been going on, or just some mad experiment in shifting away from agricultural to synthetic production. And it's been a horrible, disastrous experiment.
But it doesn't have to be. Like, fentanyl can be, the original Siegfried formula for fentanyl had a process for creating like 30% pure like synthetic heroin. They just don't use it. You know, it's not cost effective for them to do it. You know, it had to do with evaporating it in ethanol or something, and it, you know, basically eliminating the chocolate chip effect that kills so many people. Methamphetamine is the only drug we ever sample in the lab that is purely methamphetamine without any adulterants. You know, like, that's one thing is that synthetic, with the cheapness of the synthetics, comes the possibility of, you know, producing, not needing to step on it as much, producing like a pure product, if they did it right. Fentanyl doesn't have to kill people. You know, it's used in the hospital every day, and it's the instability of the way it's processed and the way it's packaged that does. And certainly the additives, like, you know, xylazine and benzos. I don't know why anybody would make benzo dope. It's the most horrible idea in the world. You're like guaranteed to kill people. In the self-censoring doctor paradigm, yeah, I mean, doctors are reluctant to prescribe them. People are getting panicked about being dependent on them. You know, and in some ways, doctors have been, you know, sort of lackadaisical in the past. My father was on Xanax. He has Parkinson's disease. He's been on Xanax for years, and nobody ever told him that he couldn't stop taking it, or he would risk, you know, a seizure or something. And until I mentioned it one day, and I was like, "Your doctor never told you this." But you know, the good news is that these analogs, while more powerful, are not fentanyl. And we were seeing a rash of fentanyl overdoses from pressed bars that had fentanyl in them. You know, counterfeit Xanax made with fentanyl. But now, and I used to think, I wonder when, you know, suppliers are going to realize that you can get unscheduled analogs like nitazenes and whatnot from overseas. And they're doing that now, because all of our Xanax, just about all of it in Kensington, comes up as an unregulated, unscheduled analog that's pressed. To look almost identical. I mean, they're doing, like, I don't know how they do it, but yeah, I know a guy who was getting overprescribed probably 92 milligrams Xanax bars a month, and 60, I think, Suboxone, and his doctor got arrested because somebody overdosed on, like, a pain patient, not in his addiction practice, overdosed. And they sent them all to another doctor who proceeded to, like, cut their dose in half of Xanax like that month, which is, like, ridiculous if you were taking it all. And then they cut it down in half again. And then, you know, and there were, like, several people that I know that were, like, just scrambling to, like, find new doctors that would prescribe.
Wow. And
he had to pay. He wound up having to pay somebody $300 just to tell him a doctor, the name of a doctor, that he then, you know, just for the tip, you know. So I think, yeah, anxiety, and as somebody that suffers from generalized anxiety disorder, you know, I mean, it affects me personally sometimes. Like, so, I mean, it's you know, for some reason people have, you know, we have no problem putting people on drugs that don't have the potential to make you feel good. My father's Parkinson's medication regimen, like, is destroying his body in many ways, but but like he still gets it, because it doesn't, make him feel good, but if you have anxiety or you have pain and you run the risk of getting tipsy or high, even while using as prescribed, it's the moralizing around pleasure, like you talk about a lot about, Troy. I think that's got a lot to do with it.
Yeah, it is weird watching how drugs on the street are just becoming more and more mysterious. DanceSafe tweeted recently on February 17th, quote, "We're seeing an unusually large number of drugs data submissions returning as, quote, unidentified, which means that they contain a drug that isn't in DanceSafe's database of thousands of substances. The market's getting even worse. Spread the word." I want to be optimistic, but I'm just like a little bit not, just seeing how people are dying and ingesting things that they have no clue about. And it just feels like, the North Star or whatever is safe supply, just having a regulated supply of narcotics or stimulants or whatever. I just don't see that happening in the U.S. anytime soon. Like, Canada is edging closer to that, but like their safe supply programs are expensive. They have very few patients. It's not meeting the needs, and people in Canada are still overdosing by the dozens every day.
Yeah, I think it's still really hard to get injectable diacetylmorphine or hydromorphone, and these are both two drugs that did fairly well in double-blind randomized studies. Like, that's the zenith of medical research.
There's all kinds of data to support safe supply. Like, some people like ask, like, where's the data? It's like, it's a real simple Google search, and it's Cochrane Reviews. Yeah, they that's like one of the highest standards of medical research, and they look at this situation and like, oh wow, it actually works. It's like common sense backed up by science. But we're always telling people like, test your drugs, test your drugs, test your drugs. But it's like, it almost feels futile. It's like, test your drugs, but like, if it's a drug that no one's even heard of or no one can even pronounce, like, then how are you going to know what you're taking? You really have to trust who you're getting it from. I don't know if there's other strategies we could tell people about, but yeah, just trusting your source is really important, and starting slow, starting with a really small amount, tasting it a little bit before you inject it, or smoke it.
Overseas and in the Netherlands, they've seen a transition to smoking. And in fact, I learned recently that more people died in British Columbia and Vancouver maybe from smoking dope than from injecting it. So like you can sort of titrate your dose a little bit better if you take a little bit. And then I've been asked, is that something you see possible in Philly? And I know the Department of Health has been, floating the idea of getting harm reduction supplies, like harm reduction foil and things like that. But I've seen one person smoke their fentanyl in the past 5 years. It seems to work some places and others, but it is a good way to, test, because the test strips are frankly useless anymore. There's only, you can't test for, you can test for practically nothing. I mean, you get fentanyl, cocaine. There's probably strips for methamphetamine. The benzo strips only encompass about the primary benzodiazepines, and that's about it. You can't test for K2 or any kind of synthetic cannabinoid.
When I was in West Virginia in December for a reporting trip, it seemed multiple people who I bumped into there and interviewed and spoke with were smoking fentanyl, actually. And I was talking to a couple guys who live in a sober house in Morgantown, West Virginia. And they said that a couple weeks prior to my arrival and getting there, that one of their housemates died from an overdose. And like the quick story is that he had just gotten out of jail, and so obviously tolerance down, and we have to account for criminalization as like one of the big variables in driving mortality at this point. Like, when people lose their tolerance, their risk for overdose shoots up. But so this guy had just gotten out of jail for a couple of days on some probably bullshit charge, moved into the sober house and was like alone up there for maybe a half hour. And he was found with a piece of burnt tinfoil on his chest. 4 Narcan doses couldn't bring him back. It was too late. And the guys told me that the like size of the burn mark on the foil was like no bigger than a teardrop, just like a tiny, tiny little dot of fentanyl on the foil is what did him in. And when I heard that, I was just kind of stunned. I was just like, so it seemed like smoking is definitely becoming a thing, but that B, it is a very fast and pretty intense route of administration. We have our capillaries in our lungs. You feel it fastest. You feel it instantly. A lot of people think injecting is the fastest, but smoking, that's the quickest crossage of the blood-brain barrier. And with this guy, like just tolerance down for a couple days, and that's enough to do it. And the kicker is that they had the guys in the house had helped him find a doctor to get on Suboxone or something, and that like his appointment was literally the next day. And so it's just like a combination of criminalization and not having access to medication like on the spot when you need it, and just the potency and irregularity and volatility of the supply seems to be just these kind of huge factors swirling around. And we could get into talking about Suboxone right now, because I think a lot of people are saying, at least online, and Crackdown, their podcast did a great episode about the limitations of using buprenorphine right now, because fentanyl, it's so complicated to try to get onto buprenorphine if you are coming off of fentanyl.
Yeah, that would be a good a half measure for between safe supply and what we have now is just flooding the streets with buprenorphine.
Yeah, I see more people fail on that, and that could be on methadone, and just be stabilized. This is also a great segue into why every single jail system and prison system in America should have a buprenorphine program, because it's the only time you're going to have a controlled setting of people that are removed from the street that can be transitioned. And I've seen that succeed, if temporarily, but I've seen people come out that were hopelessly addicted to fentanyl that were now taking their Suboxone, but it should be all it should be methadone and even Vivitrol if you want it. But I don't know if I'm tipping the hat here on something that's not been announced yet. But John Wetzel, who is the head of who just retired as the superintendent of Pennsylvania's entire prison system, is launching a nonprofit to see that happen. Hopefully someday. He's a big proponent of medication-assisted treatment in prison settings, in jail settings, and this guy could have come out with at least a tolerance. That if he did go back to smoking, the butte might have saved his life.
Yeah, there was actually a study recently that was really interesting, and it showed that with buprenorphine on board, it really is protective against the respiratory suppression from fentanyl. So like, even if somebody took their buprenorphine in the morning, say, and then by the afternoon they're smoking fentanyl, their chances of dying are significantly decreased because that buprenorphine is on board. And the way that these opioids work at the receptor sites, it's for listeners, like, think of, like a wall full of locks, and you put a key into one of those locks, and that's like the buprenorphine locking into the receptor. It kind of covers it, and your brain only has so many of these receptors. And so if you take some buprenorphine, depending on the dose, if you take like 8 milligrams, like, half of those locks will have keys in it. but then the rest of the locks are empty, and those can be filled by other opioids. But so long as some of your receptors have buprenorphine on board or methadone on board or something, it seems to, greatly reduce your risk of fatally overdosing.
Well, yes. I mean, I could say, speaking of smoking, we talk about supervised injection, and I visited On Point in New York, but half of their clients come in there to smoke crack or meth or even K2. And I found that number to be like staggering. I mean, that 50% are there to smoke their drugs, and so they're expanding their smoking room. They give out crack pipe kits there, which have become a subject of controversy at federal levels, I guess. It's not even clear to me that any federal money has been spent on these things, but people do. There's lines out the door to use their smoking rooms now.
What are their smoking rooms like there? Because I did a story for The Fix a couple years ago about the first supervised inhalation site that opened up in Canada. It's weird. Like sometimes these supervised consumption places will just have like a door to this back like atrium or gazebo or something. And people can smoke outside, which in Canada sounds pretty miserable in the winter. But the one that they opened up, I can't even remember what it was. But the one they opened up, they had like these extremely expensive ventilation systems, and there's like an emergency switch on the wall, and like so that if like somebody passes out in there, you can hit the switch and it will suck all the smoke out, and like you won't have to breathe anything in. And it really just feels like overkill to me. Like they had to have this really expensive ventilation system and the fire department come out and like do everything, and it's just like you're just smoking meth. Like open a window or something.
Right. Well, I mean, at On Point in Harlem, they're just using their 2 bathrooms. Now the bathrooms are single occupancy, so they don't have any plexiglass windows, so they can monitor what's going on in there. They give you a 15-minute time limit and only one person at a time in Harlem. But they're going to expand that and break through the 2 bathrooms and put in plexiglass windows so they can observe. As far as I know, there's no like particular ventilation issue. But looking back at some of the meeting minutes, from 2015 when they were starting to generate the ideas around this, like smoking and making smoking a component of the sites was seen as a big challenge. And it's kind of funny that we still like have this thing about smoking, like that, they tried to do away with smoking in rehabs, which is just ridiculous. It was such a backlash against it here in Philly that they walked that back. But, I was surprised by how low barrier the sites in New York really are. I mean, in Washington Heights, people can even split doses. Which is unheard of in a lot of other. That's why it's more of an overdose prevention site. Like Canada is starting to open a lot more of these where they're sort of peer led and low barrier, which has been a big critique of, say, like a safe house model here in Philadelphia, is that it's just too high barrier, which raises the cost. You don't need a doctor there really.
Yeah, the consumption sites only work if there's buy-in and people want to go, right? If it's a hassle and you need to jump through all these hoops, it's not going to attract the clientele and like the smoking thing. I mean, we have to bring it up that speaking of like the drug war and are things getting better or things getting worse, just this whole panic over the quote unquote crack pipe, media-driven cycle of racism and fear. Like I feel like like this all happened within the last 2 weeks, and like on the one hand, it feels like a major setback where the government invests in harm reduction to the tune of $30 million, which, let's be real, that's not adequate. That's not a lot of money. That's a drop in the bucket in terms of federal government spending. So that 30 million came out of the American Rescue Plan. That legislation, that package was $1.9 trillion. So 30 million of that, which is like barely registers as like a percentage, was going to fund harm reduction programs, like syringe services and places like Safe House and all the big names in harm reduction that we've talked about and heard of over the years. Finally, these programs that have been in operation for decades would get, some federal government support. And the moment that the grants are due and the application deadline is closing, the right-wing media sphere kind of kicks up this whole panic about the government distributing crack pipes and your tax dollars going, 30 million of your tax dollars are going to fund crack pipes and just like all this shit just totally hit the fan.
Don't they know that they're not crack pipes? They're little vases for a flower.
Yeah, right. It's a little glass stem. It's the most unoffensive, silly little object. Like, how could you possibly get mad about this? But we all know, like, it's not really about that. But the kicker to this story is like the White House and the Health and Human Services Secretary and the director of ONDCP, the Federal Drug Policy Agency, they backpedaled and caved and basically were like, no, the safer smoking kits that any of these funds will go to will not contain actual pipes. Like, we're not going to, subsidize, quote unquote, the smoking of crack and like, what are we doing here if this kind of thing doesn't even get like pushback from the federal leaders who are in charge of this stuff, right? Like it was just such a kind of sad cycle that we've seen play out a million times. Like it happened with Bill Clinton and syringe programs back in the 90s, right? Like we're kind of locked in this cycle.
It's infuriating because the right knows that they can exhaust the left by just making up bullshit. Like, everybody had to, like, scramble and, like, no, we got to refute this. This is not actually about crack pipes. Or, let's dredge up all the evidence that shows that smoking is safer than injecting. And, like, what do you want them to do? Like, they're going to use drugs either way. Like, that's none of your business anyway. But if they're going to smoke, that's something we should be encouraging people to do. It will save us money because, believe it or not, bunches of people dying is a drain on the economy. If that's like the only thing you fucking care about is the stock market, like, stop letting people die from preventable deaths. And this is all preventable.
The part of me is almost okay with keeping the government out of harm reduction. Like, let private money take care of it. The more the government gets involved in it, the more it's going to get fucked up, in my opinion. But that's just, I mean, because there's going to be the power of the purse, to start, implementing new rules or regulations or, I mean, it's a double-edged sword in a way.
Yeah, no, like I agree. Like I think on the one hand, governments have like a moral minimum, just like a baseline debt that they owe to the governed. Like, you all need healthcare, you all need shelter, you all need food, like just like basic things that all governments should make available for their citizens if they want to govern over a functioning society. And public health is part of that. And the government, in its current structure and in its current form and in this country, is just, totally incapable of doing public health when so many of our elected leaders just loathe and despise the public. Like, you can't do public health if you hate people. If you just don't give a shit about the public, you have absolutely no qualm with COVID deaths, with overdose deaths, with rampant Hep C and HIV and all of these totally preventable things that, on the back end, way downstream, cost way more money than a 10-cent syringe or a half of a cent little glass stem. It's like, do you want to pay for that up front and invest in it? Or do you want to treat hepatitis C or HIV for the next, however many years per person Like, do the math on, at least on the fiscal argument. But like, we can marshal the fiscal argument. We can cite all the evidence and the research. It's like not going to move the needle, no pun intended.
Yeah. All Fox News has to do is run a headline that says Biden wants to give you crack pipes. That somehow they attach it to his son, Hunter.
Oh, God.
It's like, okay. Well, I hate to make predictions, but something that's given me optimism, a little bit at least, is the DEA recently tried to add more drugs to its list of things that are controlled, which is a really fucking stupid model, that the cops basically write the laws about what drugs that they enforce, which that's totally a conflict of interest. But they said in January they're going to criminalize these 5 drugs, which if you've never heard of them before, don't blame yourself. They're kind of weird. There's 4-OH-DiPT, 5-MeO-AMT, 5-MeO-MIPT, 5-MeO-DET, and DiPT. These are all tryptamines that are sort of related to LSD or psilocybin. They're psychedelics, and the DEA is like, we got to make these banned. We got to make them Schedule 1. We got to make them hard to research and hard to have extreme criminal penalties attached. But there's a group of people that have requested a hearing with the DEA, and it's going to go to court, basically, and they're really challenging this. And, I won't bore people with all the details. They can look it up themselves if they want. But I think it's important that we see more institutions, things that are like respectable science institutes or whatever, standing up to this and being like, the DEA does not need more power. They're not doing anything productive with it in the first place. This is just going to make it more expensive to study these drugs that, like, their claims that it's hurting people are really, really bizarre, because nobody's doing these drugs really. Like, they're very hard to get. They're rare, and they don't really, they're tryptamines. They're like not that dangerous compared to like other drugs. And like some of the data they're citing on deaths are like, from decades ago. So it's like totally ridiculous. But like that does give me a little bit of optimism that more people are pushing back against the DEA's authority. We saw that with kratom in 2016. Like they tried to make kratom illegal, and the backlash was just beautiful to see. That all like these Congress people, is a bipartisan effort to be like, hey, people rely on kratom. They use it for pain and all kinds of different medications, like as a replacement. And, if you take this away from people, it's going to cause more death, more suffering. People will use other illicit substances. So yeah, that's one thing that gives me encouragement. But it's also going to be dragged out in court for a while, so we'll see how that goes.
Yeah, what that reminds me of, Troy, is just kind of the reason to me why the DEA wants to get these obscure substances in Schedule 1 and controlled. And they're also pushing for to make permanent the blanket ban for all fentanyl analogs and add all these things to the Analog Act or whatever. It's just so that they can prosecute people easier. Like the argument is like, oh, prosecutors and the DEA have their hands tied behind their back because of loopholes and unscheduled substances and all. It's harder to prove in court that these substances are analogs of already controlled substances. And so it's all just about doing more drug war, more punishment, making it easier to prosecute people. And yeah, we should all be pushing back against that as hard as we can, because we know it's futile and it doesn't work. But yeah, I think it is hopeful that these kinds of things that maybe 5-10 years ago wouldn't really cause any debate or stir up any backlash. More people are paying attention to this stuff, and yeah, I think one thing I'm hopeful about is just, maybe some of the kind of collective action and organizing that all this shit is sparking is it seems like, pain patients are, spoke loudly enough and got the CDC to rewrite guidelines for opioid prescribing. And like, it takes people, really organizing and pushing to get their demands met. And it's just more and more and more, I just see these problems as problems of political will ultimately. And yeah, in America, I think people are just so alone and so isolated that we all feel kind of powerless over, like the government and what it does. It just seems like we don't have a say, and we don't get to choose, like, how many of us really wanted Joe Biden to be president. I mean, it's just like all these critical decisions and all this elected leadership just feels like the wheels are spinning with or without our participation. And it's just like a really kind of depressing fact of American life right now, that we really don't have any way to put our finger on the scale to tip things in our direction. And so in terms of the future, yeah, I don't know, like, should we all just get prescribed heroin and live in the metaverse? Like, I don't know. like what on earth can make this feel better?
Why don't we wrap up with predictions? Like, each one of us starting maybe with you, Troy, like, and we can wrap it up. Like, what are your predictions for the next year? What do you think? Where do you think we're going to see less heat, reform, less reform?
I really do wonder what it's going to take to create long-lasting change, because the drug war is extremely unpopular. Most people, Republican, Democrat, or anything in between, we all want it to end. We all know somebody that's a victim of this war that was unnecessarily targeted or had their lives destroyed more by prohibition than by the substance that they were criminalized for. But we can't even get, like, prescription drug prices lowered, which is an extremely popular idea. Senator Sanders tried to force a vote on it recently, and like this one Republican asshole whose name is literally Crapo. I don't know. I mean, come on, dude. Like, I don't know why you wouldn't change your name if your name is Crapo, but he blocked it. And like this one guy from Idaho, we hear a lot about Joe Manchin being an asshole and blocking legislation, but it's also the Republicans in general. And I don't want to get too political on here because this is a drug podcast and not, I don't know, it's a political podcast. I don't listen to them. So, but I think it is relevant, who you vote for, and participating in local and national elections is will be one of the things that helps unravel this drug war. And one of the reasons why I like reporting on it is because it is intersected with every aspect of our culture. It's in Hollywood, it's in science, it's in criminal justice, public health. It's everywhere. And the simplest thing we could do to just stop criminalizing people who self-medicate or use drugs to feel a little bit better about the decaying planet. Stop treating people who choose which chemicals to put in their body this way. I'm obviously ranting a little and preaching to the choir, but
yeah, I mean, yeah, my, kind of piggybacking off of that, I just think because the mortality is so high and things look so grim, and we have to take into account that, Black people and Native Americans, they're dying at some of the steepest rates. And it's really sadly the case that the headlines that get made about these kind of young suburbanite teenagers who overdose from a pill they took that was just pure fentanyl. I mean, it's that stuff has a double edge. It could really spark very punitive reactionary drug policies, or because things are so bad, they could tip in the other direction. We could push for things that were unheard of 5-10 years ago. And so I think that's partly what I'm hopeful about, is just the fact that things feel so kind of chaotic that we don't know which way things are going, and things could really accelerate and go in the right direction. It's totally possible. Like, Donald Trump became president. Like, anything is fucking possible. I mean, so I think that's kind of one hopeful thing.
Well, that's my prediction, that the Biden administration is going to be more aggressive than we anticipated. I think by the end of this time next year, there'll be at least 2 more cities with overdose prevention sites. But I think that internationally, that Biden will probably be more hawkish on the drug war than even Trump was, who's kind of an isolationist and like a domestic policy guy and social, national socialist, if you want to call him that. I think Biden's going to be much more involved in foreign policy, and we'll see somewhat of a resurgence of like the Plan Colombia type stuff we saw in the 80s and 90s.
Chris, weren't you saying the other day, I think we were on the phone, and you were saying that these days people are more likely to avoid fake pills, or like they encounter a pill on the street and like they realize, oh, this is probably fake, and therefore it's probably got something unidentified. So I'm safer with the street drugs, like in the little baggie that's the powder, not in some tablet form or something like.
Yeah, I mean, it depends. I mean, there's an ethnic breakdown on that where, like, street trappers and African Americans have tended to favor pharmaceuticals. So, like, they'll take Adderall and things like that over methamphetamine. But like, when it comes to pressed Percocet, Percocet now is $2 a milligram, like, or not Percocet, but oxycodone, $2 a milligram. So, like, a 10 milligram Percocet will go for $20 a piece. I just don't see it being sustainable. But like, generally, it's known, that whether something's pressed or not, because it'll be cheaper. You can get a pressed one for cheaper. But why that's favorable to some people than just doing the fentanyl like itself, I don't know, because we've tested these oxycodone, or perk 30s as they call them here, that are just fentanyl and gabapentin and some binder. And then, as I said, the benzos are the analogs, which is good because it's keeping people that have a dependency well and not killing them, But you can always tell by the price of a drug. There's a corner that sells them for $5 a piece, where the going price is $10 a piece. Well, guess what? They're pressed.
Yeah. Well, I kind of want to leave on a sort of an optimistic note. And, I cover psychedelics a lot, and that seems to be moving in a positive direction a lot of the time. There's about 14 cities that have decriminalized psychedelics. There's all this variation there, and like, a lot of people don't even really know what decriminalized means. It's very complicated. Oregon, of course, is legalized a psilocybin program that should be rolling out at the end of the year. And a lot of other states are looking into this issue, but it also feels like an example of psychedelic exceptionalism. Like, oh, these drugs are, quote, safer, so it's okay to move the needle forward on this issue.
They're plant medicine.
But no one's dying from a psilocybin overdose. You know what I mean? Like, it's good that we don't have people get arrested for this anymore, and the people that, whether they need it for therapeutic reasons or they need it just because they want to fucking relax, they should have access to it. But that's not the real issue with the drug war. The real issue is opioids, stimulants, benzos. Those things are what's, when they're tainted, are killing people.
Well, they'll always find a way to wage the war. When they decriminalized marijuana in possession in Philadelphia, driving while intoxicated arrests went up, because they're going to start targeting you, like, and trying to determine whether or not you're high on psilocybin or something while you're driving. The drug warriors will find a way.
Oh yeah, I'm out here in California's high desert near Joshua Tree, and San Bernardino County was given $200,000 to the cops to basically go after illegal pot farms. And I see it in the headlines every week. Like, they raided this farm, they confiscated hundreds of thousands of plants, and arrested a bunch of people. At one site, they found a grenade, like a live grenade, had to call in the bomb squad. And it's just ridiculous, because it's like, it is the drug war still. Like, even though cannabis has been legal in California for a long time, there's still these illegal farms out here, and they're doing it the same thing, raiding them with the cops. Whereas San Bernardino County is the largest county in the U.S., and dispensaries are banned here because the cannabis law is like counties can opt in to having dispensaries or not. So I literally get it delivered to my house because I can't go down the street to next to Walgreens or something. So it just comes to my house. Someone drives down from Riverside County, and it's just ridiculous. Like, it's this farce, and that incentivizes these illegal farms, which are destroying the environment. You're right. The drug war will just find a new form of discriminating against people. And I think maybe that gets to the core of it. It's not the drugs that are the issue. It's the mass surveillance and the police state that we live in that needs to justify its existence.
Right. Well, the good news is that doctors are starting to come back from their especially young doctors. I've been invited to speak before a group of medical students. Like this doctor resident, I guess, reached out to me and said, we want to know how to be better doctors for and give agency to drug users. The fact that is happening and that doctors are coming up in a culture where there is harm reduction discussed in the hospital setting. And it's still, there are still terrible policies in many hospitals, but I know the two doctors we had on recently on the show, if you haven't listened to that episode, go back and listen to Ashish and Ben, really get into the sort of changing culture among some of their peers to adopt, policies that, give agency to drug users and let them decide where they want to be.
Yeah, I think that's what I was getting to a little bit ago when I'm saying, like, things have gotten so bad that, the scales could tip. And for sure, in our generation, this crisis has radicalized people. Like, I've talked to a ton of up and coming doctors who are getting into addiction medicine. And like, that was never like a advertised subspecialty or advertised and out there for students to be like, hey, here's how you can make a difference. Like, set up shop and start prescribing buprenorphine, learn how to prescribe methadone. Like, here's all the ways that you could really, really help people with addiction. And I think, I'm really, really hopeful about the future of medicine, just because the new generation coming into it, it has been totally radicalized by all their friends dying and so many people just being beaten down by the medical system all these years. So that's definitely one potential positive.
Yeah. And a big part of our audience, they seem to be nurses and doctors that are really interested in this stuff. And that actually surprised me when I found out about that. But, I guess, the people listening right now, like, you are the future. We can just talk about it, but like, it's going to take all of us to actually get the work done.
Yeah, like, we're just writers. We don't do shit.
I mean, like, the number of doctors and people in healthcare that follow me on social media has gone up. I think there is massive interest in this, from the medical community and how they can be better.
Yeah, because they actually want to help people, and the old way of doing things, shaming people about their drug use, surveilling them, or arresting them, that doesn't help people. And I think doctors are recognizing that. That's encouraging. So
I'll let you guys wrap up here because I got to roll. I got another call to get on, but
it's great talking to you, Chris.
Yeah, it's great talking to you.
I'll do it.
Check out Chris's piece in New York Magazine about New York City's consumption sites. It's really good.
All right, everyone. Thanks for listening. We'll talk to you soon. Check us out on narcocast.com.
Thanks for listening to Narcotica, an independent production by Troy Farah, Christopher Moraff, and Zachary Siegel. I'm your co-producer, Aaron Ferguson. If you like the show, you can support us by joining our Patreon. Just go to patreon.com/Narcotica. You can get some merch like stickers and more perks that are coming soon. A little goes a long way, guys, so thanks for helping us out. We're ad-free and we want to keep it that way. If Patreon isn't for you, that's fine. You can help us out by just spreading the word. Tell all your friends about the podcast advocating for social justice and abolishing the drug war. Rate us wherever you get your podcasts. Our theme music is by Glassboy, and Jenny Shea is the voice of Narcotica. Additional music is by myself, alias Nomad, drug-using producer. You can follow us on Twitter, YouTube, Facebook. I guess we have an Instagram now, too. Those are the best ways to try and contact us if you have a suggestion, complaint, or just want to tell us nice things. SoundCloud, YouTube, Spotify, and iTunes. That's about everything. Have a good week, guys.